This morning I'm going to talk about really about process and how to go about considering whether or not you want to do outpatient total joints in your ambulatory surgery center. And if you do decide to, what's the process? A lot about how and what. So today's objectives, we're going to review current trends in outpatient total joint replacement, why this shift is occurring. We're going to look at the challenges and the opportunities and the advantages of providing arthroplasty surgery in the outpatient setting. We're going to help you understand the process, patient selection criteria, some examples there, and the implementation steps required to successfully perform outpatient hip and knee replacements. We're going to go over some of the pre-op, perioperative, and post-op protocols. I'm not going to go into a lot of great detail. I think you heard some of the other speakers speak to those in today's presentation because I'm going to really focus on process. And then we're going to review the clinical, the financial models that are coming forward, the bundled payments, particularly around total joints. So a few case studies to share. If you look at Becker's Hospital Review, they did a great job pulling the top 10 ranked. Now these are orthopedic hospitals-based outpatient surgery programs. I added Campbell Clinic to the top there, and I'll share a case study with you in just a second. But if you look back at 2005, these have been going on for a while now, but back in 2005, there's a very small group of 10 patients. Total hip already was showing some results that it was more cost-effective to do in the outpatient setting. Another study done in 2009, a little more recent, in Ortho Indy, looked at the knee society scores, the range of motion, and satisfaction, and those are pretty comparable whether they were inpatient or outpatient. I think we're going to see that changing and evolving over the next few years. And then the Academy in 14 did a study on 232 patients with one surgeon. And you can see the criteria they used there with the body mass index of less than 40, no active cardiopulmonary issues, no sleep apnea, and that's a big one. Do you start to include sleep apnea studies in your pre-op evaluation? So we've had a lot of discussions around that. And you can see that there was no statistical difference for readmissions. The Campbell Clinic study is just coming out. Dr. Toy gave me permission to share this with you today. But the conclusions were the ASC group had a shorter length of stay and less post-operative pain than the hospital cohort, with no further difference in complications. The cost savings were pretty significant of $12,437, and the patient satisfaction was very high. So again, we need more data in this arena, and more publications will be coming forward in the next several years as more and more outpatient cases are done. And then from a bundled payment standpoint, this publication came out. When you look at bundled payments, it's anywhere from 35 to 47% more cost effective in an ASC than hospitals. And you can see the patient satisfaction again was very high. 98% of the respondents said that they would recommend an ASC to their family. So can they be profitable? Well, this model is very conservative model at 15.5 for reimbursement. We see much higher than that in many markets, but even at 15.5 with 252 cases, it can be extremely profitable for your ASC. So in summary, the keys to success are engaged providers and leadership. Make sure your payers will support your program. You don't want to start a program with no contracts in place or no payer discussions that have occurred. You want to design and implement a plan that fits your market, fits your culture for long-term success. You want to make sure that engage those key stakeholders in the planning process. You want to really go overboard on your exceptional patient experience because that's what will drive patients to your center. You want to educate and train your delivery teams. Make sure you have that emergency protocol in place, and make sure you're collecting your data and reporting your results. So with that, I thank you, and I open up for any questions.